So continuing on the same quality theme, I'm going to talk to you about some of the quality aspects of this alphabet soup that you see here. And really what I'm going to, Dr. Nanda couldn't make it, so I'm going to give this talk mostly focusing on how these impact from a Medicare and payer standpoint, get into a little bit what MACRA and MIPS and all these different acronyms mean and what that looks like for the future. So there are, if you look, getting back to what Dr. Etzioni said, there are all definitions that are clearly defined for all these things. And if your coders are going through this and they see something that meets the definition, they're going to put that as a complication or whatever you want to call it. And these definitions are quite complex and a little bit vague. So a little bit is like the old definition of pornography. I know it when I see it. You kind of have to apply the same type of thinking to some of these definitions. You know, do you meet exactly the criteria, or is there room for interpretation? And that room for interpretation is really why we see such variability across different institutions that probably have very similar rates of complications, but the coding gets done differently. So one common theme across all of these is it does exclude present on admission. And that, getting from the old Monopoly game, that's your get out of jail free card. If any of these things were present on admission, and there's been such an emphasis on this from a documentation and coding standpoint, you really wanted to capture that if it occurred before you inherited the patient, because then none of these apply, then you're less likely to get a star taken away on all these publicly reported websites. So let's go through a couple of these. And this will get us into why Medicare and Medicaid care so much about these. So look at CLABSI. CLABSI is central line associated bloodstream infections. There's an estimated 80,000 of these a year that results in 28,000 deaths. So that's obviously a bad thing. We want to try and prevent it. And if the CDC has estimated that there's an average of 1.8 to 5.2 infections per 1,000 catheter days. And now here's where Medicare wants to get involved. Each one of these infections results in an extra cost that they have to pay for, or somebody has to pay for, that's about $45,000 each, and total over the course of a year is about $2.3 billion annually. So it's a pretty significant cost savings if we can get rid of these. Same thing is true for UTIs. UTIs, or catheter-associated UTIs, are the single most common hospital-acquired condition. And if you look at all UTIs, about 75% are due to an indwelling catheter. 17% of these have actual bacteremia, so it becomes a more serious infection. And 12 to 16% of all hospital patients have some catheter during their hospital stay. So the risk of a UTI is about 3 to 7% per day that you have a catheter, or about 0.2 to 4.8